I'm delighted to be here. I love talking about this topic, and I just got turned on to it very recently, so I'm certainly not an expert in this topic, but I am passionate about it as I've come to learn more and more about it. It's good to see each of you here. I know that there was some big competition because there's the CE Blast Day, I think that's off-site, and so a lot of nurses are away attending that CE event. So the purpose of our time together today is to explore mindfulness and what is currently known about the role of mindfulness when used alone or in combination with traditional approaches in the treatment of obesity and eating disorders. So the objectives that we're going to be covering today, my intention is that you will leave with the ability to, after having explored the incidence and prevalence of obesity and eating disorders, be able to talk about mindfulness and how it can be used in this way. To discuss the concept of mindfulness itself, to describe the role of mindfulness as an adjunct to obesity and eating disorder therapies, and to integrate what you learn here today into nursing practice, because that's really what matters, isn't it? It's the takeaway message. It's how you apply this information. So in the introduction, it was discussed that I'm in my PhD program. Before I get into that, I want to welcome Dr. Susan Schmidt, who's here from Xavier University. And she is the director there of the School of Nursing and someone I work with very closely and who has been cheering me on with my PhD program as I'm in the 6th year and growing very weary. But one of the things that I was asked to do in my program, one of the courses that was required was CAM, Complementary and Alternative Medicine. And in the course, we were required to write an integrative review. And that's looking at everything that is known, as much as you can find, is known about a topic that is current, and to take that information and to synthesize it in a way that you can make recommendations for practice. And so, as part of this integrative review for complementary and alternative medicine, I needed to find a topic that I felt was very significant and very noteworthy. And I did a lot of research to try to kind of fine-tune what my topic was going to be, and then I stumbled upon mindfulness. And I have to tell you, it's been a transformational experience for me. I can think in retrospect that there have been times in my life that I have been mindful, not realizing that that's what I was doing. But now that I know about mindfulness, it has taught me so much about awareness and being present. And we're going to get to that. I'm jumping ahead. So mindfulness as it pertains to disordered eating was the focus of my study for my integrative review. Dietary disturbances are unfortunately very common in this country. And my review focuses on looking at dietary disturbances that involve either excessive intake or strict avoidance of food. Now, while we're going to cover very briefly today the strict avoidance of food part, the primary focus of today's session will be looking at obesity as it relates to obesity. Of course, with the strict avoidance of food, I'm talking about anorexia nervosa, which involves starvation and excessive weight loss. So folks who are obsessed with caloric intake and making sure that they don't eat too much in their way of thinking and seeing their body image in a distorted fashion. Bulimia, self-induced vomiting, often after binge eating, to rid oneself of those calories in a way to be able to eat what one wants but then purge to get rid of it. Binge eating, and most people are very familiar with this one because at one time or another, we sometimes binge eat. You know, we'll find something that we really, really like and we'll eat so much of it and we'll sit back and rub our bellies and think, what was I thinking? I will never eat again because I'm so full I hurt. That's binge eating. But there are also issues where people binge eat habitually. So it's not an occasional event, it's a habitual pattern of behavior. That's eating when not hungry, eating to the point of discomfort, and obviously that would be a precursor to the epidemic called obesity. So the psychological symptoms and signs that we see in disordered eating, whether that's excessive one way or the other, these are common signs that we see. That preoccupation with food and with eating, it takes on a significance that's beyond what should occur for the consumption of food and the enjoyment of food in a healthy way. Feeling anxious, irritable, overly excited about food, or again the other way, overly anxious about it or depressed and anxious about feeling stressed because an event is going to occur where food will be involved. Unable to maintain a normal weight, and that would be one that's consistent for age and height. I want to pause here for just a moment and clarify one thing. This is not a skinny talk. You know, there is not, don't perceive anything I'm saying here to be about a focus on thinness. This is a focus about healthy weight, healthy behaviors, healthy ways of thinking about oneself in relationship to food. And whatever that healthy weight is, whatever that healthy paradigm is for achieving health as in regards to food, is what we're talking about today. Depression and anxiety are frequently associated with eating disorders, and I would say almost always that there's anxiety related when it comes to eating disorders. Low self-esteem that also accompanies this, and a great sensitivity socially and also to comments or suggestions that relate to weight, food, body shape, and exercise. This trend that we are seeing, and we're going to talk specifically about the prevalence, the incidence and prevalence of obesity in this country, but the effect that it has had on children and adolescents in the U.S. is alarming. It's something that disturbs me greatly and is truly becoming, I can see, one of the trajectories for my future research because I feel so passionately about this. The obesity rate almost tripled among our kids since 1980. And now we're seeing that 17% of all youth and children are classified as obese. There are a lot of health issues that go along with that too. In addition, 9 million children between the ages of 6 to 19 are considered overweight. Now, there are so many childhood illnesses and disorders that we get very concerned about, as we should, which is why, we have immunizations and we have primary, secondary, and tertiary interventions because we want to prevent disease. But this topic just does not seem to be getting enough attention. It's like it's creeping in on us as a nation, and we're not being aware that obesity is making our children sick and is in itself a disorder. So I think I need to pause for a moment and define what these terms are. So underweight is a body mass index that's less than 18.5. Overweight, 25 to 29.9. Obesity is defined as a BMI of 30 or more, and severe obesity is greater than 40. I put this in red because this needs to resonate with us as nurses, as healthcare professionals, that this problem right here, the number one health threat to our children is obesity. We have got to start doing things differently because what we're doing is not working. So many of the health conditions that we used to think were limited to adults, well, guess what? They're not anymore. High blood pressure, hardening of the arteries, type 2 diabetes, fatty livers, arthritis, sleep apnea. These are not things that we think of as children having these disorders or diseases, but it's here now, it's on our doorstep. And guess what, nurses? We own this. This is something nursing can impact. It's on our plate, and we own it. So I appreciate that you're here today and that you're willing to embrace other ways of thinking about this problem. Again, because what we're doing is not working. And look at this. If kids are overweight or obese as children, they're 70% likely to be overweight adults. But wait, there's more. If their parents are overweight, make that 80%. It's hard to get them off of this cycle once they're in it, because a lot of this is learned behaviors or behaviors that don't involve stopping and thinking about what I'm putting in my mouth. The epidemic of obesity in the U.S. More than a third of adults over the age of 20 are obese. And 2/3 are overweight or obese. 2/3 of our nation. That means, of course, you're already doing the math, only 1/3 are in a normal, healthy weight pattern. 2/3. As you know, the problems of obesity and overweight are associated with these other very serious health issues: type 2 diabetes, stroke, even cancer. Many types of cancer. That's something we don't really stop and think about. We don't hear about that very much, but there is a direct link. And of course, associated with heart disease, which we know very clearly is the #1 cause of death in this nation. Obesity is the second leading cause of preventable death. This is something that's completely preventable. So if we rehash for just a moment and think about what we've already talked about, the significance of this problem, how prevalent it is in our country, how it impacts children, and it puts them in a pattern of lifelong health issues that could be avoided. I again have to repeat that as nurses, this is a perfect opportunity for us to step forward because we know about prevention. This is what we do. This is what we do best. We've got to become more involved as nurses and advocates to reverse this problem. So we're going to go back in history a bit so you can see what this looks like. In 1990, no state in the nation had an obesity rate of more than 15%. None. By 2000, 23 states had an obesity rate that went between 20 to 24, and by 2010, no state was less than 20. So we went from 1990 to no state being above 15, and now in 2010, no states less than 20. That is a phenomenal increase. Dr. Schmidt's an epidemiologist. Dr. Schmidt, that's phenomenal, isn't it? It is, and it's work. You're right. In 2010, now we're looking at no state that's less than 20%, and 36 states now have obesity rates of greater than 25. 12 of these states have prevalence rates above 30%. We're looking at a third of the population of 12 states have obesity rates over 30. And all of the health issues that go with that. Diabetes, that is skyrocketing. Heart disease, continuing to skyrocket. I underline Kentucky because that's where I'm from. I love Kentucky. I love Ohio too. I do. But I love Kentucky. That's where I'm from. You can probably detect a small accent. I was born and raised down in the Appalachian region of Kentucky. First generation college student. And everything was pretty much typical what you would think for Appalachian region. Down in the area that's south of Cumberland Falls, Lake Cumberland, if you know where that is. I still have a lot of family there. And one of the things that really propelled me to want to become a nurse was even as a teenager growing up, I saw such poor health. It was different then, though, because what I saw among the students that I went to school with, it wasn't this. It wasn't obesity. I saw very, very thin children that I went to school with because they didn't have good diets, and it was a totally different time. And it was very rare that we encountered this problem when I was growing up. But what I did see were kids who didn't have proper oral hygiene and didn't have healthy diets and who didn't know what it was like to have a primary care physician. I was fortunate in that I did. But I went to school and saw this, and it bothered me. And I thought there has to be a better way to do this. And then when I started learning about nursing, I just knew that was my path. So Kentucky is near and dear to my heart, but Kentucky is a very, very sick state. And we rank 5th in the nation for obesity rate. We're at 33% for Kentucky is the percentage. However, I'm sad to say to you that if we look at the incidence of overweight and obesity among children in Kentucky, that rate is 37%. So now we're going to walk through time visually, and you can see it on the map. So I want you to pay attention. Right now we've got lots of nice light blues. I love light blue. It's such a good color. But we're going to see that this is going to change and start watching the patterns of the color change as we move into red zones. And I'll do this a little bit quickly because I want you to see the changes. I want to point out here, though, where you see white, those are non-reporting states because this was in 1985. And the surveillance systems weren't quite in place. They were just really getting started at that point in time. So you're going to see very quickly all states began to participate in the surveillance system. So at this point we're looking, if you see the legend below, the blues indicate less than 10%, 10 to 14%, and that's pretty much where we are, around the less than 15%. Oh, well, suddenly a big jump up to 1990. We are now looking at lots of the dark blue zones. Now we're in the royal blue zones where 15 to 19%, and about half of the nation is at 15 to 19% obesity rate in 1995. Now we're starting to see it increase to 20 to 24% by 2000. Here's 2001, we're starting to see that dreaded red color. Now look what happens very quickly from 2000. And the areas where you see the really deep wine-colored red, those are areas, again, those 12 states, one which is my home state, that color. So this is what it looks if you look side by side from looking at each decade at the progression that we have made without any reversal in the other direction. Now this is something I have to repeat again. Since the 1980s, when we started tracking this data, not one state has begun to reverse this trend in adult obesity. Not one. But we keep doing diet and exercise, right? That's the mantra. Diet and exercise, that'll take care of it, right? Wrong. Certainly, diet and exercise are extremely important, critical even, in maintaining a healthy weight. But clearly, there's more. We're missing some key components here that are making that system work. So again, 80% of all states, 39 out of 50, with this prevalence rate of 25% obesity. I jumped ahead of myself. Sometimes I get excited about this part. Jump ahead there. So enter mindfulness. See, there's hope. I painted such an abysmal picture, but it gets better from here, I promise. I'm glad you haven't left the room. Mindfulness. It's such a simple, beautiful concept. It's paying attention. It's being purposeful, attentive, intentional, deciding that you're being mindful right now. You're present in the room here with me, and you're all giving me such wonderful attention, and you're looking and you're engaged, and you're being mindful that there's something here that apparently you value because you're giving it your attention. That's what mindfulness is. Being present in the moment. It sounds so simple. It's not simple, is it? Not when we're pulled a million different directions and we're wearing so many hats and we're being so many things to so many people. It's hard to stop and be mindful. But we do it. We do it, for example, I like to give this example with kids. Kids learn mindfulness. One of the first ways that I think is through teeth brushing. So, when they're little and we introduce them to the toothbrush, and then over time, we keep making them brush their teeth, and they're like, oh, Mom, I don't want to brush my teeth. But they do it, and they do it, and they do it because Mom says. But then what happens when they get to be, 9, 10 years old? Mom doesn't have to say so much anymore, Susie Q, go brush your teeth, because now Susie Q values it. It's something that matters to her. She's incorporated into her ways of knowing and thinking because she sees maybe kids at school who don't brush their teeth, and she sees and feels social issues that, you may not be accepted as much if you don't take care of your teeth. So it's something now that she has taken in and made it her own. Now she's mindful about teeth brushing, not because I'm telling her she has to be, but because it's her own value that she's adopted. So when we're teaching kids in school, you have to diet and you have to exercise. And we're telling them, you need to do this because this is what your superiors tell you, or those who are, in authority figures are telling you this is what you have to do, right? Kids don't get that. They don't understand that. But kids do understand mindfulness, as we're going to see in a few moments. And this is one of my favorite parts about mindfulness. Non-judgmental. The whole point of being mindful is not when you mess up and you have 3 pieces of that apple pie instead of 1, or you totally fall off the wagon and you mess up your diet for a week or a month, or you mess up your diet for 10 years. Okay, you move on. You say, okay, I can do this better because I deserve better than this. I am a unique, beautiful person that deserves more than this. And I'm going to choose health for myself. And if I mess up, I'm going to forgive myself and make better choices the next time. It's the absence of judgment. Here is what mindfulness is not. Sometimes it's a little easier to see the reverse. Before we see what it is, we'll see what it's not. This is not mindfulness. These are, so often we get into behaviors that are not consistent with what our goals are for ourselves. Now, I know no one has ever in this room texted and driven or been distracted by, being on the phone or, of course, everyone can relate to these kinds of things. This is the extreme, but I've passed drivers doing this before. Have you? Yeah. I mean, this isn't a stretch. This happens. Another example of not being mindful at a time when food's involved. And I would dare to say, although I don't have any data to support it, but I would hazard to say that so often, especially we as nurses, we do a lot of eating while we are also multitasking with other things. As a PhD student, I've been very guilty of this. It's so easy to have a bowl of chips, and I love chips. And to have it sitting there while I'm on the computer and I'm piling in the chips and not even tasting them. Sometimes it feels like this. Sometimes it feels like we're trying to balance a dozen things at once. And sometimes it feels like we're not doing any of them well. And maybe it's because there's an absence of mindfulness, because we're so stretched and we're so plugged in to so many things that we don't experience what's happening around us, or in this case, with the experience of food. So with mindfulness, we distance ourselves from interpreting these habitual patterns and assigning them value. So when I'm sitting at the computer and I'm wolfing down the potato chips, then I could afterwards really just beat myself up and think, well, gee, what kind of nurse are you? You just ate a whole bag of barbecue Lays. Love them. You just ate a whole bag of barbecue Lays. You call yourself a nurse. You call yourself a nursing professor, and you're the director of research? Really? I mean, I could get on that path, but there is nothing constructive about that. And as destructive as that is, I would say to you that we do this all the time when it comes to food. We assign emotional values to it that then makes our decisions then ineffectual, because we feel guilt and there's all this emotion that's linked to it, as opposed to stepping back and distancing oneself from that and deciding what is it that I'm doing well here and what is it that I'm not, so that I can make better decisions instead of mindlessly making the same bad ones or poor ones or unhealthy ones. And in so doing, we can reframe our response. So I have to tell you, I've had to come to the decision that when I'm sitting in front of my computer working on my PhD, I can't have chips there because I will eat the bag. I know I will. I know me and I will. So you decide, what is it? What are your triggers? What are your weak points? What is it that you can do actively and proactively to circumvent those? So in my course, my CAM course, I did a review of the literature to look at this concept of mindfulness. And the literature was just very broad and vast, and so I needed to fine-tune it a bit. So I narrowed it down to interventions such as yoga, meditation, awareness, eating awareness training, and also cognitive emotional behavioral therapies, such as those that are used to help a person reflect back onto their experience and expression of emotions as it pertains to food. I mean, step one is realizing that we do it, right? I mean, first we have to recognize that we link the experience of food to emotions. And I'm not saying that's always a bad thing, because food is a wonderful, beautiful experience. And we celebrate life with food. So the journal articles, I finally narrowed it way down. I started out with about 250, and I narrowed it down to 35, again focusing on the mindfulness-based approaches for obesity and eating disorders. And the most common thing I saw over and over again to help teach and utilize mindfulness was through yoga. Does anyone have a thought as to why yoga would be a good way to learn about mindfulness, to experience mindfulness? Go ahead, Mary Lou, tell me.
Involved at the moment.
So Mary Lou said it's because you're concentrating and you're focusing on being in the moment. That's what yoga does. It causes you to think about and experience the present. And that's why yoga, it was one that was the most common. Also meditation for the same reasons. Cognitive therapy, eating awareness training. And this is sort of that. This is kind of an eating awareness training. But again, the majority of that was centered on yoga. And yoga, of course, we know there's many health effects. These I have listed here: balance, flexibility, improved heart rate. And so it makes sense that that could translate to other problems such as disordered eating. Folks who are in a pattern of disordered eating often do this because they're having difficulty tolerating something in their life, a negative experience, a negative it's a negative expression of distress very often. And then food is used either in an overly restrictive way or overly consumptive way. So in my research, I found many articles that supported that with yoga, decreased symptoms of eating disorders was experienced, along with decreased BMI, lower hip and weight measurements, an overall reduction in food consumption, healthier food choices, and practices that slow the eating process. Now, how many times have we sat down and just devoured something and not even tasted it? I mean, we just eat without even tasting what's in our mouth. I mean, with mindfulness, it causes you to be deliberate and to feel the texture and to taste it and to taste the spices and the sensations in your mouth, to actually chew and experience how the pleasant experience of food, because we're hungry and because it's nourishing our body, or sometimes maybe because we're not hungry, maybe because we are celebrating. That's fine. But it's slowing the eating process at a time that we're maintaining awareness of what we're eating and why. Anytime that we are eating and we are during a period of time or experiencing emotional distress, our awareness is narrowed. We're less aware when we're stressed out about something. And so food can be used to block out that awareness, because it can't be an individual's experiencing something that's so painful or stressful that using food helps to circumvent that distress, and it's a distraction. There are certainly many, many studies that are in the literature to support that yoga relieves stress, and therefore could be another way to augment mindfulness. I mentioned that I was going to talk with you about school kids. This study that was done by Skyme, Cook, and Cotton, it was a 2-year study looking at middle school girls, 144 in this population. And the mindfulness intervention excluded diet and exercise. So it wasn't focused on that at all. It was simply mindfulness, teaching kids what this is and what it means. And so the question was, if we teach these kids mindfulness, will it reduce their risk factors for eating disorders? And I'm happy to tell you the answer was yes. Look at this. They reported greater satisfaction with their physical appearance. These kids who are in school and they're obese or overweight, they have a tremendous amount of stress because of their physical appearance and about their body image. It's a tremendous amount of stress for them. So, greater satisfaction with their body appearance. I love that. Fewer eating disordered attitudes, because they were aware, they were thinking about the way they think about food. They were stopping to consider how they're interpreting their world of food, and they were beginning to unplug circuits from that and replug in somewhere else and think about food differently. Another study done by Daubenmeier and colleagues looked at mindfulness in the reduction of abdominal fat and cortisol in obese women. And this was a rather small study. That's something that I kept seeing over and over again. So many of these studies are too small. They need to be replicated. Nurses, they need to be replicated. We need to be doing more here. We need to study this because we own this problem. We do. So, only 47 in this population. The mindfulness techniques were similar to yoga, and they incorporated stress reduction strategies, cognitive theory, again, the way we think about food, eating awareness training, and then what they found is that these techniques with the obese population of women resulted in definitely an improved mindfulness, improved responsiveness to bodily sensations, reduction of anxiety, decreases in emotionally stimulated eating. Again, they're aware, therefore, they're beginning to make different choices. And significantly improved weight maintenance. However, the control group during this same period continued to gain weight. Sometimes success, and particularly in this case when we see an epidemic of obesity, success would be to stop it. To just, before we can reverse it, we have to stop it. We have to stop this escalation. So at least, even though this is a very small study, it showed that, look at this, they maintained their weight. That is success. That's something to aspire to. In this study by Crystal and colleagues, this was a wonderful sample size, Dr. Schmidt, 15,550. And they focused on the effects of yoga to curb middle-aged weight gain, which we know this is a common problem. In middle-aged folks, they start to easily put on weight. They looked at yoga to enhance awareness of overeating, respect for one's own body, and positive body experience, and found that the practice was associated with lower weight gain, only 3.1 pounds among those who were already in the normal weight range. But then look at this. Lower weight gain among overweight people, 18.5 pounds less. Now this is a really good study. And it shows us that this helps to stop that process of ongoing weight gain. Remember I mentioned at the very beginning of my talk that no state has gone the other way? None? This is something that we really should be strongly considering to infuse into the way we think about weight management and weight loss strategies. And this brings me to cognitive dissonance theory, which is looking at ways to make our values consistent with our actions. I showed you early on that picture of the person driving, on the phone, eating. I can promise you that none of us, when we get inside a car and we make a decision to text or to be distracted drivers. None of us would choose for ourselves to be in an accident or to cause one. We wouldn't choose that for ourselves. But yet, it's common sense that when we choose those behaviors, we are putting ourselves at an exponentially higher risk to be involved in an accident, so we do it anyway. That's cognitive dissonance. We're so disconnected from the effect of our action, we don't stop and think about it. That's gotten a bit better with the use of seat belts. You know, I'm sure probably most people in the room remembers a time when seat belts were not mandatory and you didn't have to wear them. And so when we went through a period of time that we suddenly had to start wearing them, some folks didn't like it and, you know, really complained that it was something that was legally required and felt that their rights were being violated. But now it's become just a way of life, hasn't it? We get in the car, we put on our seatbelt. And it's gotten to the point if we don't put on our seatbelt, we almost feel vulnerable not to have it on. Why can't we do the same thing with weight management? Why can't we, just like when we pause to put our seatbelt on, we don't even think about it anymore because it's become ingrained in our ways of thinking and believing. It's become valued like toothbrushing in children. Why can't we also pause and think about, we're talking nanoseconds here. What am I eating and why? Am I really hungry? Do I really want this? Is this something that I want to put in my body? And if so, if the answer is yes, if I want to continue on this pattern, then I need to step back and think, maybe there's something else going on here besides food that I need to be thinking about. Cognitive dissonance helps us to consider what we're doing and is it consistent with what we want for ourselves. And if it's not, unplugging circuits from that and making different choices. In this study, researchers examined dissonance training and taught, in this case it was women, to understand the thin ideal and how the media can really cause issues for a woman's, and I'm not limiting this to women, but often women are targeted in the media with this thin ideal. And we began to think that that's something that we have to aspire to. That's why I said to you earlier on, this is not a thinness talk. This is a wellness-focused talk about food. And so that's what happened with this particular group. The researchers taught women about what's different between the thin ideal as defined by the media and what is the ideal healthy weight for you. They talked about feminism and oppression among women and how this has come to happen over time. And as a result, there was improved self-awareness, reduced anxiety, and the researchers said there's tremendous implications here for obesity and eating disorders. We could be doing more here. Another program, mindfulness-based eating awareness training, or the MBEAT, MBEAT program, was a focus on self-regulation. So participants were encouraged to develop self-awareness, and there's that free from judgment piece. It's not about judging oneself. It's about being aware so that we can choose better. They identified internal strengths, they learned effective coping skills, and they were able to use mindfulness meditation practices in order to control binge eating patterns, which of course, as we know, is the precursor to obesity and overweight. Mindfulness. It's relevant to cognition and learning. It's an essential part of the holistic component of weight management that is missing in this country. We don't have that mind-body connection down. And we're certainly, as a nation, although there's pocket studies in a lot of places that are very promising, but as a nation we have not adopted this idea of connecting mind and body and teaching children to do that. That's where it starts. Remember that stat, 70% of kids who are overweight or obese will grow up to be overweight or obese. So that's where we have to get them, is when they're children. And we have to teach them this connection, to be aware of themselves and what they're thinking. Mindfulness also encourages us to understand the experience and expression of emotions. In this case, as it pertains to the way we eat. And in so doing, by reflecting on what it is we think and feel about it, then we can challenge those beliefs and decide, okay, why do I think that? Why is it that when I watch Monday Night Football, that I have to have a big bowl of extra buttered popcorn sitting on my lap and shoveling it in and having a beer on the side? And I do this because that's just what we do at my house, right? I don't watch football, so it's not a very good example, but you get the point. You know, we often sit in front of the TV and we do this, and we don't even taste what we're eating, but we do it because that's what we do when Monday Night Football's on. Maybe we need to challenge those beliefs and unplug and look at what we're doing and why, and if it's the best choice for us, so that we can respond adaptively, so that we can adapt to change and decide we're not going to be part of that paradigm anymore. Now here's my favorite part of the whole talk. The implications for nursing, the so what. What are you going to do with this now? So what? Well, here's so what. When we're looking at a nation where most of the population is overweight, then we as nurses have to do something. And with the knowledge that childhood obesity has tripled in the past 30 years, this is something that as a nursing profession should keep us awake at night. Because everything about this is prevention, which is what we do best. Unfortunately, as I was doing my research on mindfulness, I went to the federal obesity guidelines to see, well, is mindfulness in there? No, it wasn't. But there were recommendations for drugs and surgery. And there were recommendations for cognitive restructuring through intensive psychotherapy. You know, this just isn't practical. This is not a practical solution to a nation with 2/3 of its inhabitants overweight. We can't all just run off and have psychotherapy or have surgery and take diet pills. This is not practical, nor is it optimal. But yet nowhere in these obesity guidelines says anything about this mind-body connection like mindfulness. That's another thing you as nurses can do. Impact public health policies. Help change the way we think about this problem. It starts here by an increased awareness. Again, mindfulness, absence of judgment, heightened awareness of self, being in this moment like I am here with you now. This is mindful. This is a wonderful expression of mindfulness. As we've talked, mindfulness is associated with reduced food consumption, healthier choices, slower eating processes, and individuals who can respond more adaptively to problems as opposed to choosing unhealthy eating patterns. I wanted to I know you've seen this already, but I thought it was worth showing it to you again, because this is something I hope you'll go out and talk about. I hope you'll go find 5 other nurses and tell them about this. And start the dialogue, the nursing dialogue that says, we won't tolerate this. We're going to change this because this doesn't work. Practical application still here. So increase awareness as an adjunct to traditional weight management strategies. I am not here to tell you that diet and exercise does not work. That's not what I'm saying. I'm saying it doesn't work for this nation in and of itself, separate from the connection to the mind-body spiritual connection. We can't circumvent that. It has to be part of the dialogue. It has to be part of the plan. Also, part of the plan is challenging our beliefs. You as nurses need to stay current on what's happening in the literature about mindfulness and other strategies that augment current ones, so that we can inform our profession and practice based on evidence and be better nurses and stewards for the patients whom we serve. Consider contributing to the research. Do a project. And there are so many things that you could do. And call me up. I love talking research. I'm happy to come to you. I love getting out of my office and going out and meeting you and hearing about what you're passionate about and what kind of problems you want to solve. And if you want to get on the mindfulness boat, let me know, because I'm looking for some soldiers. I would love it. And practice mindfulness yourself. Be attentive. Be present. Be aware. But don't judge. Let that go. Just let that go. Create mindful zones and honor them. Now, what I mean by that is, the next time you get in your car and you're behind the steering wheel and you're tempted to pick up your phone just to quickly check or just to do just a quick little text message, I want you to hear my voice. You're not in a mindful zone. Do you want to be there? And I want you to also begin to hear your voice when you start to make unhealthy choices about food, or you see patients who are doing it, and we can help guide them to enter a mindful zone when it's time to eat. And think, just pause. Is this what I want for myself? Is this what I want for my body? So I hope that you will, I wish you much success with your mindful zones. If you have an opportunity to go out and share this information about other ways of thinking about obesity, and you have some stories to share with me, I'd love to hear them. Don't hesitate to let me know how I can support you in your research and evidence-based practice efforts in any area. I'm honored to be a nurse, and I'm delighted to be here to support you as nurses. Thank you for your attention.